Okay, so on to our types of cold techniques. We talked about a couple of these in our immediate care video already, specifically this ice bag. But all these other ones, again, are means by which we can get to the point that we can help reduce pain or muscle spasm to facilitate exercise. So at this point, which one we use is really about matching it to our patient's needs and our needs as far as timing, as far as what's available, as far as preference, for a way to reduce pain, reduce muscle spasms, and facilitate exercise. So first one we're going to talk about is the ice bag, which we already talked about in immediate care. Again, we're usually somewhere between 32 to 34 to 36 degrees Fahrenheit. You want to ideally use our crushed ice that we talked about. For all of these, we always want to inspect the area before we apply any cold to make sure that there aren't any open wounds, that we know what the skin looks like now so that when we remove, we can tell if they're having an allergic reaction or something like that. So always inspect the area, prepare the ice bag, get all of the excess air out that we can, make sure it's the proper size for the body part. You can also add multiple if the body part is larger versus just trying to make a larger ice bag, which could trap air and so on. So thinking about size and number. Wrap with an ACE wrap if we want compression to be applied as well, which post-immediate care is not as important, though compressing will increase the cold faster. And so our goal really usually is for post-immediate care, we're just trying to get to that point that the person's numb, that they have the pain relief. And so if that happens faster with some compression, that might be beneficial to your patient. We want to place a towel or something over the top. So if we don't wrap it with an ACE wrap, we want to have something to insulate. So when you have the ice bags sitting on the individual, they're going to, heat is going to get removed from the body and go into the ice bag, but heat is also going to get removed from the environment into the ice bag. And so that environment is decreasing your heat capacity, heat storage capacity of your ice bag because it's melting your ice. And so it's not just the heat we're pulling out from the tissue. So if we can insulate that against the environment by putting a towel over it, that will help. So we don't do this very often, but it's definitely a way that we could, again, facilitate the cold application to happen quickly. When it's time to remove it, we inspect the area again and make sure that, again, there's no reactions occurring because of the cold. So most often we do this for acute injury or inflammation. Again, that was our kind of immediate care situation. Acute or chronic pain, post-surgical pain, edema, muscle spasm. Usually our treatment is between 20 and 30 minutes. Again, when we talked about our cold physiological effects, we talked that with an ice bag on, we got to that numb point, usually in about 18 to 21 minutes. And that's usually our only goal when we're talking about post-immediate care. And so somewhere in there, now again, adipose tissue is going to increase that, so we might have to be higher towards this end if we're in a really fleshy area. Be careful again of that superficial nerves over the compression. It can cause some nerve palsy, especially again the peroneal nerve and the ulnar nerve. So those are really close, the outside of the knee with the peroneal nerve, so the lateral side of the knee, and then the medial side of the elbow. Watch out for that compression. Next one we have is ice massage. So this is using a cube or a large pop of ice. So basically what we do is we freeze water in Gatorade cups, and then we can remove part of the paper as we apply the massage. You can also stick a tongue depressor in there while it's freezing and make like a popsicle, and then you have a little handle. You could also put some antibiotic solutions in there. So then if someone had, like, think about like really bad turf burn or something like that, where we could apply antibiotic and like kind of a clean, sterile environment and kind of clean the wound and provide that cold to help numb for the pain. But usually we're talking about 6 to 8 ounces of water. It's super messy, so we want to lay down a lot of toweling to protect the surface of the table and the patient. Make sure that they're not wearing clothing that's going to get really wet around that area. And then it becomes about massaging. And so we usually talk about it with muscles. So again, it combines with our cryo stretch that we talked about in the last video, where you can actually apply that pressure and slowly stroke as you move. Adding that resistance, that pressure, will also increase the numbness. It'll happen faster. Our temperature is about 32 degrees Fahrenheit. And again, we want to inspect the area before and after. This one, we would, again, don't use it in our immediate care as much. So it's subacute injury, acute and chronic pain. I would put muscle spasms on there as well. It's great for that. This usually gets someone to the numb point faster than an ice bag because of that pressure and the direct contact with the melting ice versus being in an insulated bag. So you can potentially get to that point in about 10 to 20 minutes. You do not want to use any pressure in the ice massage if that pressure would be contraindicated. So obviously if they have a fracture, we wouldn't want to put that over it. Or if they have, again, that really acute pain, we wouldn't want to do that pressure over it. Compartment syndromes where we don't want to increase pressure, all of those things. We use it a lot on small, evenly shaped areas. The treatment area should only be slightly larger than the face of the ice cup itself. You don't want to try to do the entire quad or the entire low back, because as you move away, you're going to let the blood come back into that area and rewarm that tissue before you come back to it. And so it just takes too long. So you'd want to do smaller areas. It's fairly convenient, pretty practical, pretty time efficient. It does cause a rapid decline in the intermuscular temperature. And so it's really effective for, again, muscle spasms, contusions, other minor injuries. You don't get any compression though, and we can't do it while compressing, so not great where we'd want compression. Next we have ice water immersion. So this is sometimes called a slush bucket or an ice bath. This is where we take a plastic or rubber container or metal, we fill it with ice, and then we add water to turn it into more of a slush. And so we're usually somewhere between 32 and 34 degrees Fahrenheit. This is going to be the fastest, but it's also going to be the most uncomfortable. So you really have to, you should always do this, but you really have to explain those 4 sensations. So again, the cold, the burning or pain, the aching, and then the numbness, and help them get through that, distract them. I love this. I specifically keep a victim in this one. Keep the victim distracted. Keep your patient distracted so that they get through those stages. Something that can help is that toe cap. So again, you'll have that exercise while you're experiment with the toe cap versus not the toe cap. So uses, we can use it for any time we want to eliminate pain, especially quickly. Not great when there's a lot of edema though. So we have post-surgical pain and edema, but we can't elevate and we can't compress while doing this, and we're in a gravity dependent position. So it's not great for edema. It's really effective to work on that cryokinetics of facilitating the exercise because it's relatively quick and it gets interarticularly. This is one of the best ways to cool when you're trying to cool inside the joint as well. Again, only takes about 10 to 20 minutes. It could even be a little bit less than that. It depends on the temperature and the area you're trying to treat, how much adipose tissue you have in that area. So again, you'd want to measure that. Again, inspect before and after. This one especially, you want to take distal pulse and check capillary refill because of how cold it can get. You also want to watch people. If you're going over a bigger area, you want to be careful because it's so cold that it can affect their sympathetic nervous system and how they respond. So you don't want anyone passing out or anything like that. So watch your contraindications very closely. So next we have our cold whirlpool. Okay, so usually our cold whirlpools are much warmer than we've been talking about. We've been talking about things at about 32 to 34 degrees. Now we're talking about something between 50 and 60 degrees. And so again, for larger areas, this is what's more preferred because it has a less risk of that extreme cold. But it's also going to take a little bit longer. So I have 10 to 20 minutes here. At 50 to 60 degrees, you're almost always going to be closer to that 20-minute mark. Again, you want to inspect the area. You can offer for them to use a toe cap. And whenever we're using the Whirlpool, so our Whirlpool, our metal one, doesn't have a turbine. It's essentially a big bucket, okay? The one that we have portable has the option for some jets. Other ones will have jets or turbines. If you have a turbine, you always want to, again, you're mixing electricity and water, so we want to be safer. So what you do is you turn on the agitator before the person gets in. okay, or immerses their body part. So you turn on the turbine or you turn on the jets. Then you have the person immerse the part to be treated. Okay, you adjust the air or water mixture or where the jets are pointed so that we get a good movement of the water, because that's really the point. We need that movement. Even back with the ice water immersion, when they're in the bucket, just like we talked about shaking the bag for the ice bag, you want to actually move the water in the bucket. So you want them to have to do some range of motion potentially in the bucket, you know, dorsiflex or plantar flex their foot. Or you can even come and kind of shake the bucket, because again, they'll get this little bubble of warmth around them because of the temperature gradient, and you want to disrupt that. The cold whirlpools, you're less likely to get that because you get the jets and the convection moving the cold water around. So when the treatment's over, we remove the body part, and then we turn off the agitator or the turbines or the jets. That way the person's never in the water when the electricity is being sent or interrupted. They go in when it's already running, and they get taken out when it's already running. You want to make sure it's comfortable for them. So if they're hanging their arm over the ledge, can you put pillows? Can you do something to protect? Also with the cold whirlpool, you get the benefits of the water. And so you get buoyancy to help you. You get some resistance. You get hydrostatic pressure. So if you need some reviews of that, I'll have a couple videos up on Moodle to review what buoyancy does and how that helps. But buoyancy will help reduce the compressive forces on weight-bearing joints. We think of it more in rehab when we're talking about doing like full body immersions and water jogging and things like that. But we can do it in a smaller scale when we're talking about doing exercises in the cold whirlpool. So again, we can be doing range of motion or things like that. The water will also provide some resistance depending on the direction that you're moving. Hydrostatic pressure that the water exerts on the body will also potentially facilitate some recovery. So acute and subacute conditions, especially if you want to do some exercise during the treatment. Again, some of that range of motion, we can do that in the water more so than when someone has an ice bag on or ice massaging. You need a GFI, you need all the safety for this. Again, I have 10 to 20 minutes, but probably closer to 20. The patient should not operate while in the water, and it's not great for swelling control because you're in that dependent position. As far as maintenance of the whirlpools, that's really important. You're dealing with big bodies of water, especially when we start talking about warm whirlpools in the next section. But maintenance is to just follow the manufacturer's guidelines. You want annual maintenance. You want to make sure the thermometer is calibrated. You want to make sure the machine gets calibrated, the turbine gets calibrated. Routinely check the ground fault interrupter and all the electricities. You also want to clean the whirlpool, so you should clean it before and after patients, especially patients with open wounds. No one else should use that water. Otherwise, typically we clean it at the end of the day. Okay, our final cryokinetic or cryotherapy for the post-immediate care is talking about cryokinetics. And so again, this is that facilitating exercise. So the effects we're shooting for is we're trying to decrease pain, potentially decreasing the arthrogenic muscle inhibition, all in the way to facilitate exercise sooner in the process. So the advantages are that we allow exercise sooner. It's really relatively inexpensive because you can use any form of cold therapy that you have to create the numbness. The disadvantage is the extreme cold can be painful at first. It's fairly messy because you're dealing with either water or ice or things like that. Also kind of getting the buy-in. People are used to not icing before activities, so you're kind of switching that up in their heads on them. Indications, the example that I'm going to show you is for ankle sprains, and a lot of the research is on ankle sprains, but really any joint sprain where you're trying to regain range of motion is probably what it's best indicated for. You could do it potentially for some muscle stuff, but for the most part, joint sprains are really where it is. So our applications for our cryokinetics, again, our contraindications are going to be all of our cold contraindications that we've been showing in our charts, especially the cold hypersensitivity, but also any exercise that ends up causing pain. Remember I said we're going to focus on that re-injury pain? So numbing the area will help decrease the residual pain from the initial injury. But if they experience any pain during the activity, that's potentially new re-injury pain, and we would need to back off. So use pain as your guidance. When they're doing activities and weight-bearing activities, especially, we don't want them in limping. We want them to use good form. And so if they're limping, we need to step back and take them back and teach them how to proceed without compensation. And it can actually possibly increase pain and more so soreness about 4 to 8 hours, and that should be after the activity, not after the injury. Meaning that because we're actually working that area, they're going to have maybe some soreness after. So this is something that we'd maybe alternate with or do maybe every other day, or know that they're going to be in a little pain that evening, but probably by the next morning they'll be fine and able to do it again. So our pre-application steps, all the same things we've been talking about. Explain those sensations, okay? Get toweling, make sure that you can remove equipment, and prepare your equipment. And it's going to depend on your application technique. So basically, we just need some way to numb them. So the most effective is usually, and again, if you're using a smaller area, like the ankle or the wrist, the slush bucket, the ice water immersion is by far the most effective because it's quick. You can also do ice massage. You could also do an ice bag. You could do cold whirlpool, but those are all going to take a little bit longer. And the ice massage, depending on the area, is a little bit difficult if you're going over really bony spots like the ankle. And so you can use any of them, but your goal is to get them to numb. So it's going to take whatever time. And so ice water immersion is one of the quickest ways to get to that. But it's also one of the most intense, so you got to kind of weigh those things. So again, you're going to inspect your body part, check your sensations and your distal pulse, and then you're going to numb the area. So if you're doing ice water immersion, that's going to potentially take you about 10 to 20 minutes, and you're just getting them through those 4 sensations to the point that they say that they are numb. If they never are getting towards that numb point, just stop at 20 minutes, and you're probably good enough nerve conduction velocity wise at 20 minutes for an ice water immersion. And then the key of this is the exercise. So this exercise should take on what you would plan for like a normal rehabilitation. It's just you're using the cold to decrease the pain. And so after we numb the area, we perform exercises, about 2 to 3 minutes worth, because then the numbness will start to wear off. And once the numbness is starting to wear off, then we re-numb again. And now because we've already been numb once, it should only take about 3 to 5 minutes of either ice water immersion, ice massage. An ice bag might take a little bit longer. And then you exercise, re-numb, and you do that for about 5 bouts, okay? The goal during those exercises is that they're pain-free. If it causes pain, we go back to our previous level as far as our progressions of the activities. We begin with really simple range of motion, and we might progress all the way up to sport-specific activities. But they really need to perform those without pain and with normal rhythmic coordinated faction. So they shouldn't look real jerky or, again, have any compensation or limping. And it takes a lot of encouragement on our part to kind of educate them and keep them going on that. So the dosage really just becomes limited by pain. When they experience pain, we slow down and back off. Typically our length is about 5 exercise bouts, and we can do it up to 2 to 3 times a day. I would say people usually do this once and then maybe do some activities without being numb. And the duration is until you get your patient back to full activity. The idea being we'd want to be weaning them off of the cold and doing the activity without the numbing. So usually we'll start an activity with the cold therapy, and then the next day, if they tolerated that really well, they might start their rehab without the cold and doing those same activities and see how they tolerate. And if they didn't tolerate, we go back to adding the cold. If they did tolerate, then maybe we can do the cryokinetics and take it to the next step, and so on. And we just keep doing that. Post-application, all of our same steps, making sure we document. Remember, kind of warn them that they might feel some more additional pain about 4 to 8 hours after. And actually, ironically, applying ice for about 30 minutes after the activity can help with that. Okay. And then again, maintenance is just depending on what you use. If you need toe caps, replace those, repair those. If you're using a container, making sure there's no cracks in that. So this is an example that I've seen for ankle sprain based on research. So these are the activities that you would potentially work your patient through. This is not all in one day. So like one day early on, we'd be maybe working on non-weight bearing range of motion. Can they do that numb? And then we'd advance to them not doing this, or doing this without the numbness. And then we can progress through. So each stage might be a day or a couple days, depending on how they're progressing. We might combine some non-weight or some weight-bearing range of motion with working on walking, doing short steps, doing some weight-bearing weight shifts like we have here, right? You know, we might combine some of those things within the activities within their 2 to 3 minute bouts. But for the most part, we're kind of taking steps and then progressing them. But again, the goal is eventually to get to doing each of these things without the cryotherapy.